You've seen them everywhere, right? Star ratings, letter grades, top 100 lists for hospitals. These report cards are supposed to make a super important decision, where to get medical care, way simpler. But what if all that data is actually just making things muddier? In this explainer, we're going to dig into why the answer to that question is way more complicated than it seems.
I mean, it seems like a pretty straightforward question, right? How do you know if your hospital is any good? You'd think you could just look up the numbers, find one with 5 stars, and call it a day. But what happens when one report gives a hospital an A for safety and another one gives it a C? As we're about to find out, the data itself can be, well, a total minefield.
So here's the thing. There's just so much information out there coming from all these different places that it can be completely overwhelming. One report might put a hospital at the very top, while another sticks it right in the middle of the pack. This isn't just frustrating for us as patients. It creates what experts call indicator chaos. It's this bizarre situation where more data doesn't help, it actually makes things less clear.
Okay, so before we dive into all the problems, let's back up a bit and talk about the idea behind all this. Because look, there is a really powerful theory at work here. A theory that, on paper at least, should make healthcare better and safer for every single one of us.
The official name for it is Public Performance Reporting, or PPR for short, and the core idea is actually pretty simple. By making all this performance data public, a couple of things are supposed to happen. The hope is that first, we, the patients, can make smarter choices. And second, that it'll push hospitals and doctors to actually get better. It's all about transparency and accountability. Okay, so this whole theory really hinges on 3 key pathways. First up is selection. The idea is that we, as patients, will act like savvy consumers, picking the best-rated hospitals and creating market pressure for everyone else to improve. Then there's change. This is where hospitals see their own data, spot their weaknesses, and hopefully make improvements from the inside out. And finally, you've got reputation. And this one's simple. Nobody wants the public shame of a bad grade, so that fear should motivate them to up their game.
So yeah, that's the theory. And it sounds fantastic on paper, doesn't it? But what actually happens in the real world when these report cards get released? Does all this public reporting really lead to better care? Well, the evidence is, let's just say it's complicated.
All right, this is where things get really interesting. So this table here, it pulls together the results from dozens of studies. And check out that first row. For patient experience, things like how well the staff communicates, these reports have a 100% positive effect. Bam, they just flat out work. They also seem to encourage internal quality improvement most of the time. But then things get a little tricky. They have a much smaller impact on our actual patient choice. And then you get to that last row, unintended consequences. Almost 70% of studies found a dark side to all this reporting.
So this is the big paradox right here. These report cards are fantastic at making your hospital stay more pleasant. They're really good at pushing hospitals to improve on things like communication and just basic service. But they're surprisingly bad at actually changing our minds about which hospital we go to. Remember that selection idea? Yeah, turns out it's the weakest link in this whole chain.
But let's be clear, when that change pathway does kick in, man, it can be incredibly powerful. So get this, a hospital in Toronto saw in a public report that their sepsis infection rates were way too high. So they dug in, did a full review, and realized the root cause was something pretty simple. They were overusing catheters. By fixing that one thing, they didn't just boost their score, they were literally saving lives. This is the system working exactly like it's supposed to.
Okay, but let's go back to that scary number from a couple of slides ago, that 68% showing negative effects, because now we have to talk about the dark side of all this data and the really serious unintended consequences that can pop up when the pressure is on to get a good score.
See, when the pressure to get a good score gets really high, some providers might start focusing more on the score itself than on the actual quality of care. The goal can kind of morph from let's give our patients the best possible care to let's just make sure our numbers look good. And trust me, those are not always the same thing.
And this is where we get into something called gaming the system. You've got stuff like cream skimming. That's when hospitals might start turning away sicker, higher-risk patients because they're afraid a bad outcome will tank their scores. Then there's teaching to the test, where they put all their effort into the stuff being graded while other important parts of care get ignored. It can also lead to risk aversion, surgeons just refusing to do tough but necessary operations. And in the worst cases, it can lead to straight-up data manipulation. The bottom line is, the patient isn't getting better care. In fact, they might be getting denied care altogether.
So yeah, this is a massive problem, right? If the numbers can be played with,
then the whole system of public reporting starts to crumble. So what's the fix? How do we get back to a place where we can actually trust the numbers that are supposed to help us? This right here is a perfect example of why this is so important. I mean, that sounds incredible, right? Come to us, we have no infections. But it's basically meaningless. Which infections? How did you measure that? Over what time period? Without any real standards, a claim like this is just marketing, not medicine. And that can be super dangerous.
So, what do the experts say? Well, the proposed solution is actually pretty brilliant in its simplicity. Start treating healthcare quality data with the same seriousness we treat financial data. Think about it. A big company can't just make up its financial numbers, right? They have to follow super strict rules and get audited. So why on earth should the data about our health and safety be any less rigorous?
What this means is creating a really strict, totally transparent rulebook for how this stuff gets reported. It would cover 3 big areas. First, you'd have to be crystal clear about the patient population, who's included in these numbers and who isn't. Second, the measure. You have to define exactly what you're measuring and prove that it's actually a good way to measure quality. And finally, the performance data itself has to be presented honestly, showing you trends over time, giving you the raw numbers, not just some polished final score. It's all about making sure the data is truthful, timely, and totally transparent.
So the next time you see a hospital report card with a star rating or a letter grade, just remember everything that's going on behind the numbers. Look, this data has so much potential. It really can make our healthcare better, more focused on us, the patients, and way safer. But without strict standards, without a real commitment to honesty, it can also create some really dangerous incentives. The data is out there, it's public, but the most important question you should be asking is the one right here on the screen. Is it honest?